Good afternoon, everyone. My name is Tori Surgeon. I'm a research associate with the Johns Hopkins Center for Indigenous Health. I'm joined here today by Dr. Laura Hammett, and we're going to be talking about the positive impact of childhood vaccines in Navajo Nation. So as I'm sure many of you are aware, children receive a lot of vaccines before they reach the age of 5. So in the interest of time, we're just going to highlight 2 of them here today. So the first is called Haemophilus influenza type B, or Hib vaccine, and the second is pneumococcal conjugate vaccines, also known as PCVs. And the last thing we're going to discuss is how we can actually protect adults from blood infections and pneumonia using PCVs. So first, what are vaccines? Normally what you think of are shots that you receive in your arm, but they could also be in pill form, they could be a nose spray or a liquid. The goal of a vaccine is to teach your body how to defend itself against a disease. So we want your immune system to know what to do before you ever encounter the disease. Vaccines are safe and effective. They go through rigorous testing before they're approved for use. And on the right-hand side here, showing you how effective vaccines really can be. So one of the really common childhood vaccines is called MMR, and that stands for measles, mumps, and rubella, which are all listed there. And in the red bars, we're seeing where we started. So that's the annual 20th century morbidity, and that's just another way to say the average number of people who were getting sick from these diseases in the 20th century. And you can see for measles, that was very high, over 500,000 people on average getting sick each year. In the orange, you can see what it's reduced down to after the advent of vaccines. So in 2021, there were only 9 measles cases reported, and that's a more than 99% decrease. And it's a similar story across all of these diseases that were once very common and caused really severe diseases and impacts upon the community. They've all reduced down substantially. So today, the 2 vaccines we're focusing on are the Hib vaccine and PCVs. I'm going to start by talking about Haemophilus influenzae, which is also called H-flu. It's a type of bacteria or germ that's usually spread by coughing or sneezing. Depending on where H-flu is found in the body, it can cause either mild or severe disease. So an example of a mild disease would be an ear infection. More severe diseases are lung infections, also called pneumonia, brain infections, which are also called meningitis, or very severe swelling of the throat that can sometimes impact the ability to breathe. And this is called epiglottitis. So despite the name H-flu, it doesn't actually cause the flu. It causes these diseases I've listed above, and it is treatable with antibiotics. So it's very important if your child is sick to take them to the doctor so that they can be prescribed treatment. Because sometimes if a child has severe disease like brain or lung infection, it can lead to hospitalization. If it's untreated or very severe, it can lead to brain damage or long-term hearing loss, and in the very worst cases, sometimes even to death. So this is a disease we can treat and we can also prevent. There are 6 different types of H-flu. So I think we talked about this a lot during COVID, and a lot of people are familiar with the term strain. So that it just means that there's a slight difference. It's still all the same type of germ, but there are small differences in the outside of the germ for H-flu. And based on what the outside of the germ looks like, it's assigned a different letter. So for H-flu, we have 6, and there are A through F listed there. Before vaccines were available, most of the severe disease was being caused by type B, which I've highlighted. So that's why a Hib vaccine was developed. We really wanted to target the most severe disease and have the largest impact. So this vaccine is recommended for all children under the age of 5, and it does only protect against Haemophilus influenzae type B. So now I'm going to walk us through the impact that this has had on Navajo Nation. So in the late 1980s, before there were any vaccines available, on average, 19 Navajo children under the age of 5 became sick with severe Hib disease every year. So that's a rate of disease 4 to 5 times higher than what the general US population was experiencing at the same time. In the early 1990s, the Hib vaccine became available and was approved and recommended for use. And this led to a 90% decrease in severe Hib disease on Navajo Nation. So we went from an average of 19 children per year down to just 2. And since 2017, we have not seen any cases of severe Hib disease in Navajo children. So to summarize, Hib vaccine is a routine childhood immunization. And what that means is when your baby goes in for their well child visit, this is one of the vaccines that the doctor is going to recommend that they receive. So this vaccine has been around since the early 90s, and it protects specifically against Haemophilus influenzae type B. And Hib disease used to mainly impact babies and kids under 5 years old, and it can cause very severe disease like lung or brain infections. Through the use of the vaccine, there's been a huge reduction in the number of children who suffer from severe Hib disease. So before vaccines, it was around 19 per year, and we've gone down to 0 since 2017. And at the end of the day, this means we have fewer kids who are experiencing those negative long-term health effects. So hearing loss, brain damage, fewer kids in the hospital, and fewer kids dying from something that is preventable. Now I'm going to switch gears and talk about pneumococcal conjugate vaccines, also known as PCVs. So these protect against Streptococcus pneumoniae. This is also called pneumococcus. It's another type of bacteria or germ, and it's usually spread by coughing or sneezing. So similar to H-flu, pneumococcus can cause either mild or severe or invasive disease based on where it is in your body. So some examples of mild infections would be an ear infection or a sinus infection. A severe or invasive infection would be one that occurs in the lungs, the brain, or the blood. And Streptococcus pneumoniae has been responsible for up to half of the middle ear infections that we see in kids. So this is a pretty common pathogen, and it is treatable with antibiotics. So there are 100 different serotypes of pneumococcus, and these differ by the type of sugar that's on the outside of that germ. So pneumococcal conjugate vaccines are available to protect against invasive pneumococcal disease, that very severe disease that might occur in the lungs or the blood or the brain. They were first introduced into the childhood immunization schedule back in 2000, and since that time they have been updated. So when you're hearing about pneumococcal vaccines, the name has a number in it, and that number is telling you how many serotypes it protects against. And so similar to H-flu, the goal was to target the ones that were causing the most severe disease and the ones that were the most common. So let me give you an example. On the top there, you can see PCV7. This was the very first pneumococcal conjugate vaccine that became available in 2000, and it protects against the 7 serotypes that are listed there. In 2010, PCV13 became available, and it added protection for another 6 serotypes. That's why it's 13 instead of 7. And then just in this past year, PCV15 and PCV20 have both become available for use in children. So PCV20 does protect against 20 of the 100 serotypes. And by protecting against more, the goal is just to reduce disease down as low as we possibly can and provide the best protection to our children. So how has this been working on Navajo Nation? In the late 1990s, before we had any vaccines, an average of 47 Navajo children under age 5 would get sick with invasive pneumococcal disease each year. That's the really severe disease that we talked about earlier that can impact your brain and your lungs. That rate of disease was more than 2 times higher than what the general US population was experiencing at the same time. After the PCV7 vaccine was introduced and started being used, over that decade, the number of children who were becoming sick each year with invasive pneumococcal disease decreased by nearly half. Then when we received the updated PCV13 vaccine that added additional protection for 6 more serotypes, there was another 80% decrease in the average number of cases. So we went from 47 before vaccines down to 6 children each year. And then, as I mentioned, this past year, there were 2 new vaccines that were licensed and recommended. These protect against even more serotypes, and we're going to be keeping a close eye to see what the impact is. But we do have very high hope that this will bring our number down even lower. The positive impact of pneumococcal conjugate vaccines isn't limited to only children. People of all ages in the community have benefited from their use. So this graph on the bottom is showing across the age span. So we have kids under 5 on the left, then adults 18 to 49, adults 50 to 64, and our older adults 65 and up. And that blue bar is showing the cases before we had any vaccines available. So incidence just means the number of new cases. The red is showing the time frame that we were using PCV 7. And then that gold is showing when we introduced the updated vaccine, PCV 13. So when you're looking from the red to the gold bars, you can see across every age group, the gold bars are lower. And that indicates that we have reduced disease further. So that was a very significant reduction. And again, when we look from the gold bars to the brown bars, we see another reduction. And those brown bars are representing the COVID-19 pandemic. And we think that this reduction we saw during COVID-19 was related to all of those mitigation measures that were put in place, like wearing your mask, social distancing, limiting the number of people that you gather with. Those were very effective in reducing the spread of COVID-19, and then similarly, they impacted diseases like pneumococcus that spread by coughing or sneezing. So although we did see these reductions during the COVID-19 pandemic, we have started to see invasive pneumococcal disease come back. So now on the left-hand side, I'm showing you just before the pandemic started a few years. You can see it's relatively stable, the number of cases that we're seeing in Navajo Nation. Then there's a big dip when we get to those brown bars in the COVID-19 pandemic, and it starts to come back and actually climbs up higher than what we were seeing in pre-pandemic times once we get into those blue bars. So I'm calling that the post-COVID era, but we know COVID-19 is still around. I just mean that we have lifted a lot of those restrictions, like mandatory masking that were in place. So we saw this come right back up to pre-pandemic levels and even a little bit higher. And I want to talk about what's been driving a lot of that disease. So remember how I mentioned there were 100 serotypes of pneumococcus? One of them is called serotype 4. And serotype 4 has been included in every available vaccine. But it is the reason that we're seeing a lot of invasive pneumococcal cases in the past 3 years. So on the bottom there in the green, on the far left side, you see before we had any vaccines available, serotype 4 invasive pneumococcal disease made up about 7.5% of cases during that time frame. Then the vaccine came out in 2000, and you can see the number is reduced down to 1% or less. So it was almost eliminated through use of the vaccine. And then now, coming into 2022, on the other side of those pandemic measures, it was accounting for 25 to 30%, and it remains high. So far this year, it's accounted for 22.6% of cases. So all of these cases have been occurring among adults in the community, and the median age of those adults is 39 years. So that just means that most folks clustered around that age. Most of the adults who were getting sick with serotype 4 invasive pneumococcal disease were unvaccinated, and they had at least one risk condition that indicated they were eligible for vaccination. And so the two most common conditions were alcohol misuse and cigarette smoking. And this increase in serotype 4 invasive pneumococcal disease is not unique to Navajo Nation. It's happening in many other places too, in many other different types of communities. So I've just highlighted two here. On the top there, it's talking about an increase that was noticed among adults who are experiencing homelessness in California, Colorado, and New Mexico. Also, during the same time frame, there was an increase in invasive pneumococcal disease due to serotype 4 up in Alaska, especially among the Native American Alaska Inuit population there. So because we're seeing a similar trend in an increase in serotype 4 invasive pneumococcal disease among two Native American populations, both in Alaska and on Navajo Nation, there was a call to action issued by Dr. Christensen, who is the Indian Health Service Chief Medical Officer. And what that means is she's asking physicians to prioritize giving the PCV20 vaccine to adults who are eligible, because we want to prevent serotype 4 invasive pneumococcal disease, and we know that the vaccine can do that. So the best way that we can protect adults in our community is by vaccinating those who are eligible. And adults are eligible to receive this vaccine if they're age 65 or older, or if you are an adult 18 or older who has a condition that puts you at increased risk of pneumococcal disease. And so some of those conditions include cigarette smoking, diabetes, cancer, chronic heart, liver, or lung disease, alcoholism, or a weakened immune system. And any adult with those conditions should consult with their healthcare provider to see if they're eligible to receive the pneumococcal conjugate vaccine. So to summarize, pneumococcal conjugate vaccines are part of the routine childhood immunization schedule. They were first introduced back in 2000 and have been updated a few times since then to provide protection against a greater number of serotypes. The serotypes that are included in the vaccine are the ones that had previously caused the most severe disease or which were the most common. The use of these vaccines has led to a huge reduction in invasive pneumococcal disease among Navajo children. So before the vaccines were available, on average, 47 children per year were getting sick with this invasive disease, and it came down to 6, and we really hope to see it reduce even further. Pneumococcal conjugate vaccines are also recommended for adults, especially adults over 65, and then those who have certain risk conditions may be eligible. And it's important that adults receive this vaccine because we have seen that increase in serotype 4 invasive pneumococcal disease, which is vaccine preventable. So I just want to wrap up by giving a little perspective on childhood vaccine coverage. So this graph is showing children under age 2, and each of the lines is showing the percentage of children who have received the appropriate number of doses for that vaccine. So we've talked about 2 today, the Hib vaccine, which is shown there in the red line, and pneumococcal conjugate vaccines, which are shown in the purple. And so in 2015, you can see for all of these vaccines, coverage was quite high. It was up near 80%. In some cases, like for Hib vaccine, it was up at 86%. Then when we hit the pandemic, not just Hib and PCV, but all vaccines for children had this big dip. And we know that there was sometimes an inability for folks to access care during the pandemic. We were really hoping to see a rebound as we came out the other side of that. And we have, but we just haven't quite reached those same very high levels that we saw before. So we still have some work to do to make sure that children in our community are protected adequately against these diseases, which can cause really severe impacts on their lives. Vaccines are such powerful tools to protect children and adults from disease and improve well-being in our communities, but we have to get those shots into arms. We have to make sure that people have access to those things. Please stay up to date on your vaccinations. If you have any questions, you should definitely reach out to your healthcare provider. And I just want to close by acknowledging all the people who make this type of work possible. The Navajo Epidemiology Center, our partners at the Indian Health Service and tribal clinics and labs, the Center for Disease Control and Prevention, the IRBs, and of course my colleagues at the Center for Indigenous Health. Thank you very much for your time today.
Yat she sheila go to din she aro ma ideshkiji ein shino kilchini bashishino but ani da shi chain on kaina da shinale tana kana na hosa de inasha ado na in Georgia as el inge native medicine coordinator had no na nishigi hot shanghai sindo shina nishisha a ko DJ ko banket la hasna vaccines hol yahagi is hot ban na hasna a ko alt asago kwaige ha benia vaccine hol yahagi chudeli do ha yes yat do kaige na hat no bahanetle o eugen jo hot vaccines gi chon alo vaccine gi jo ha ishin dalni do yadat hegi bits ha dotse kodo hot de dol na do de not in la benia kaige alt so go na hilchedish all. Next slide. A coco hayu kwaige do dana zinda the vaccine bedi nigi ad zegi jo yul at alcohol ha ishin dat dalne do ya dat hon dalni aho yana da hadalne ado lata yande ag en da hale hoda hot ya dat dalne dat azo dat kosta dat jo kwaige ya dal ka yego ein dal ka do ze baadal do hot dol nata bits kwa nalni gibits do hot dol nata giben na hot dalne ako vaccine delne belagana ketche akoko you ya do dashe don senda do yat eta bahat da no da hot ya dalt kille a hot ende yego einal ka yego senal ka ade enda ya be lalle aro konde na hokade ne do sani til keje kel chini yaje ado di masane che dan linigi a hot ya bar da hakha kodo bedol na bedol na tapenia ado bedol na ande do yego it's ado tje honita do le do yego it's ado kado gala jo yesepenia hot be ba khayado hot abe ba dat a koko ha ibeni na hot juk adishji de la hot hinitna leda ni himasana ni hiche ado kon hichoda dat hegi jo ya la hot ada hinant ado la hot abe in agina zlane ako eben na do yo alaik khata hita khata ado huge ya an le ze en dan saida jo hot ya chota yos obeni na yego ya but is na bato leden dat de snegi na bato shin do ya dat do yo ba den idan de dischi de sa hotza a kon lene bel chi le haden shi amasana sani jo aje de ko yise a ko sani amasana dan lenegi jo ha ishi ze don le ze naske do childa de yul at anansa yul at ado chian dan le de beto an den agi jon le dat hita ado atak etoda den agi jo de yan ado ze chota yos only the neba as agi chota yos only ze nasked ado go hweta dat el go hwete lleni el de dat lleni jo chota yos kodibits sigi artwich ha no hot ya na gale ako ado nas ol chilo jo belni chi ako ebony na din hits sigi yuja lage ha no hot da hadat na hechi le chini yaja na hechi I da but is altwich ha hot na hechi ho but nas ol chi jo adont la hotza ado kadishji de la hot hinni na do ha huge llahoza nihich llahoza ado ishin hinagon dal to dazli le haira da choda inigita jo at llahoza akodi le nan segi llahoza ado at on na haidni sali le na da o kenda na haidni do ani hina nilt da sali ayan de din le lejan de llahoza adon le troda llahoda za tro aben da de go he na haltkino da troyada en da llahoda za jo hayu kaya pa ka o llaho ho ni adon le ishi panda ki le o hayuj jo ein le lle den hat ha ged no sambi den hat ha ged ado hat ashin chodal in le chide da bahagi ado de kwigo shin at jo ein le den ha ged jo ein nel chigi bin helle ado trohi da bin helle ado da bes na hat ti ho ado do de rano yelto så li ako ebenin na lenan sen llahoza adon hich do llahoza le gata dat jo da de dan lo da ado de bedo danilt li da ado be gashita o hayuj an hich adon le bi dat da jo ado llahoza ado thodo llahoza ado llejo llahoza aro ebenin na llaho ho zago kokote an hi dane do yo dan da selin aro kint khaten jo hot yan na hidni selin aro le nihits isa bahadel ini badel llahada jo do llahod jo ishi u yuta betra a coco do chul insidli a co eben na ya din hits sigi a twinch na bahe ayo ba ohtazli adon le na khalchne da hodat do ye go lage na bahta dazli a co eben na di ze hot dal indo an le chito belat bespadat jo di kwa ya holne de kwishin la da chini ya jo bespadat no jo ai chito hot bespadat so kobut sigi artgunch ha ni don le ishin dal ni do dal dogi eben na hot chul indole ado katla ha ho zagi ben na do jon hinel chlahot ani hitro llahot aron hinnago shito yada hindal to aron le zelga da jga ho da le ha shi khajda ho da o yut ilze ada na o yada ye hot ya ba a honsen she accords ilze o balni ho yada ye tasli a co ebits ado jo ha ishin that eshata ze that do yada ahigita ado bik in haltino jo ado thon that the goton le sheja bi in that le ado childa bahan da hal tasli ado to ze yada anle Ata chidabak ata that ahita akonya da ye to lebe hasht at the hal iniki dan de let's up khata kisto lebelta ikisi da jo hotat ahita o khayu o le ha de shin that yata ye ho jo bik en haltki do ado o nasa haita dansta haita neho adon den hossando tropin helleho eben na laho hotza adon el keda jon hitrogi anle hata zinigi deitland eben na le na loshi that ahida belta itla ben na edo haida bedel hon hito don hitel net and jo kwage chana ba hagi dan hi holon den akodi laho trogi laho zago ben na aba ohanta hasli aro anta zeda dik adeya do yon nata haltkin ho ben na jo tkin pa ho dat eya ze dan set jo dat ehida yan le kimpa hogo jo kodo chidi lo da ade bi khasi lo da aje bahanda halle ben adot ilzeda da ni da o yo bet khahon dan set azli oben na shat o yo chudel in da azli sto an hene khaz ado o hayuja to ni tsigi edi altro ich na ba to le to altro ich ha ni do beni ya ni tsigi o you go at da il in da John le chego da strahan de na ho jo edin hits isigi bet sket do bet zil adon hits igi do do ha da bahan da halde ho do ben na le ahata ajeta ni da edo da to yetnel na dan da halde higi allergies de ni da to ho da ne jo le yasigi yatrata de kiso yastrahan da na ho akodi bekhagi gi yego dan is adon de bigete to yego alskun cha halen da halle ado le tratcheta da hegi jo do hot out tratcheta an da kha din le dat to da yuch hata alnido ado desk azo da yuch hata alnido jo hot aben hot del ina karedo yo hotel ingo benani hits isigi ayo alato yuch hata alnida dazli ado so de zenda ado na hagada o hayu hot adal on edi hats isigi artskuncha halnido artskuncha betzil eben na hot adal in jo da pa otazni ado Nalni o hayu de ni hikeya betrahnni edin le haden shi de shni do hat shi chiyan da bieto juk adeya chiyan le yadizne da bieto da da hilni ho hot ade da ako o hayu ha ishi da betrato ha ishi da bio nzago yan aznel bene ya hot it's and hot ishi pa hatar koto na da konsta jo dat hida edin hits is betra il on hot yi dan da jo ha yo li in le ha inil lenegi art kon bebeja ha inil ni don len hits is na pa ha ki ha an ado bedel da hido le la khana halchine da de no da jo o hayu ha ishi da betra jo hotat hegi da chul on dan hits isigi ho ani ado dishta shi hot ahida ado hanni da la pa da jil hotat ahida jo o yu ha ishin da betra ho dat ko hot jo chul on eben nine hits isigi do yo alt kunich ha ni da sli do alt kunich betzi da sli ako eben na ya ha ida ne hota jo da hat ashin lat na khata hanji jo immune system bedi nenegi jo altskunch na pa to len da desne to ishin to ya da hegi agent na pa immune system hisnenegi akoho do ha yuja la ho zagi benina ya ayope otenigli ayope osli ko na ko vaccines hat nenegi chul is ba ya quage ha ishi to ya dat na khana pa to le hits ist khato a kon hits isigi betskau alskunch hana odni dole a koton hit dol nata ado jan hitol na ante to yego na khata huitos ala to yego bek khadi data jo eben hot vaccines bedi nigi hot chul dole. Next slide. Ado dis gide ani ego la hot da ani ya o hayuje ya ada huilian ado be da huilianigi to jo an let o nan set o at o holon ni hinago holone aro la hot zago benina dishin de la hot ya hini nasidli akago chian de hot achul inigi da ya an le contes just jaho ajet o that is just jaho congi beach just isla a con late that just isota تيخان جنة دان لي بتخوي دان لي جن دازلون أدو هوت أجلت إيسا أدو كونجي دو بجت تزلزنو أدو خونش كيش دو بك كونجت سيكو جو هوت نهيج إيان إن دنيل زنغو أدو دنيل زنغو يدان أدو يات صد زندون تاه كيس يات أهيجي بل جو هوت الكدان هوت دا إيدان أدو إيدين هوت نهلا بل الكديل نهو تاه ديل صديل زنلا جو هوت إيدان قد دنيل دات بيجن نتا نيل توسلتلين أدو ليد داليا التو ليد داليا هوت دهيلني هوت بين دا نيل توهي أو بيتيت هي آدنا نيل تو آدنا هوت إيدي لي كنت خاهوتا جو دو هوت أو هاشي داليا أجن كلا الوت أو ديت أهينسن جنو جو هوت خيتنا هوت بك أنجليها أو تكين لجي جو كدا هوت جيان إن أنا خنا نيل لنا أجيتا دا هوت جيان جيت سنجي هوت جيل إن ديشين هوت الزيت ناسكي دي الزيت الكوشين شات أنانسات كوشين شات أجو كتا الزيت لي صحتات ديل بيجو كدو كوسن كتل نهتا دا كوسن كتل نهو كتا الزيت لي ni in oza dal yedo kushin shandat jo hot chul in kadeto yo chul in da sidli hakoni tit in the ni hoda ni tit in the ne hoda jo aida le kingon da hani higi is aida chul in do le edo da zel in da na khada hajahi jo hot chul in do le so o tskin so akoko keda ya an nan sagi hot chul in the adot khotok adishin de ayo sahodza kadeya o hayuj saho ni so saho zagi benina etro bahadalne in lech astuit in the kushin tapi dazlin josh keda zilgat hadazlon da ado anne den hadazlon da jo do haida chinda do da bahtan den agitlan den kadedishin de astuit in bedet nigi o hayu tapi gopinina tropa hadal ako hot chul en sitlin ako hot chul on jo yat ho ya to haida bi o hot yitla ado keda jo ya le yastrana na ho adon le yitzasota tsade dochin bahita tsadili ado unta titlin to patch yan itilin hot ya del in ako da yo de nilsen kad ya saho hotza benina adish ashiat hot chon idon lehli no ba yelki lende o hayujen saho hotza benina apa hastisli ado nan segi so o hayuni hichiya endan sana le Ochen dat egi ado chast ejida ado zadleta ado de ze odi dat egi ado de kwishin at hot an hichiya dat en an de dan sel de zra oda hot an dan sel en del iho en hichiya an ado kadeya sahot benina stok adishji de o hayu nits asigi to laich halni da to allergy bedi ni to yeshe hitnel ne da sitli to akochi da hota satachi da hota ita ha hoshi dil khostaile ni hidayet aya hotni la edo da ya satata eti zi la jo edi allergies ni hot ni hin ashtrota na allesh edo da ni hin attrota na allesh le jo allergies a koto yo konto ni da heben na kadnitsis chil hot andan saido di betkhadatin bet eshita dat don hidden do bedni na da sitin don hidden na da ako nakata hata aja jo hot hot za to do ha ishin yi danshin do ha ishin yi lanshin do ne hit ispi heli enigi jo ko hat ashin ya bahas distinta hota a ko o you that asian yan yi dan I dan ha shin khanta hoitos ahlto le ni jeda edo ta ya le shi khani da o khayun hitel khatole heart disease diabetes that ishna jo that a high blood pressure that ishlen le ni hitel da do da gano na alkit ole jo a ein lich yan o YouTube hashit eshi ado do ya le anan segi yochul in da sit legi benina ado ya di zene da bi yegi de shnit u yu haishi besel khata ya jo do ba opa ito le anzago sa ado le anzago the not do le benia jo hot da ako dane jo sto kagen hits isat ashi ya ta hos ato le u yu yi dan adon le namasi peskan like at o yu that jo do hot u yu ha ishita bi ako da u yu da enel ho do ba ho needs no jo hat ashi needs istra ya ta huitos ado kedando jo ya ini masanada ni che da badak at the halon aro the bending sta bekashin den sta clean den sta ko yunanish le o khata ad H rahi a masanada a che da ado ade clean da ya jole ado yani jata senata yani jata ado the beta being that in at the honey daughter jo hotat sache dal nesto sache khata the kha ako ya a trahodel ze hat nenigi sache hot de in ado dun le na gloshi bana nishigi o khayu jo yu je bana nish khat de gesh dat ati khat de gesh ba holjish adon le hashitat eshinta ayajata bijata ta bitati tlita bekrashi jo dat ehigi jo o yu hot anan nish a kujina lo benan nish de on ko aita trata ta hatel zehens ado ikhrehota nada dilro ne khilkhahan zikrego da randa dilro und kadedo yo it inda aber ohanta hale hashida hot ego de ati hot de aro hashida hot ego ati dag et halondo de betanaj je begrashida da halon shin da halo aro ikreta dan da de do da randa del wo jo hot an le de ne masan ne che di de hot khen hit shot his zaza jo hot ane ik hui kregoben na bet ist da hot ne dishin de da ba o da halle a koko ado di de o yu je ya na hagahagi to so de zinda dat o tlangi jo do ye go na stay can't con le o sado do chi do kinalta ho do leche ado do getcha jo bik ho in na hagi date ehne na haga o hayu ado so de zinda ado di de yele darne da jo ada pa on da halle dasli a kobeni na o yuja hat ashi en da hast ako ebony na di the vaccine hat ninigi jo yes ya chul on ya at dishin saha ho za do saha hini nanigi benina ebenina ya koje zal in the vaccine gi ban he kana wo ya at next slide jo kwai ge ya ba hwilne a koko nadne skot ako di ya nadnish ani jo kwage bahon di de ya holna ze ishene lede hot o khayu elchene di hot abeta hetel ne hopeni na sa yego bich nda hui na dazli arona na sa ya ben na بقينا تاسني آروتي إزاي حزلين دو بالبعض تسقو يدوك خايدن خاطة تازني نو هت آيانا حسنة كوشين زي شات أني نانا دي نانا شايانا هولنا أوجو دي دكوسن تايجي شا شا هت هجيل زوليجي يحتاحوش آدو خونش يحتاحوش an coco ben aya do jona hete zita dale jo do quaige quaige di de quishi asat stok at sani do has trubel bada a ko di de kosen sabets ado kote lebe jail zolegi da do the note in Lapania, jo could bespada, senodo yahalne, jo could pneumonia yeslinigi yaholne sto. Jo that ego the quishin o hayu hot abata hedelne has tuisani aida hakazi the rahota aida del coso adonde hot it elabatni even quag ot ze Italia a kohodi jo ya ni nalnish ado di ze idai chando papani ye go nal khat onle do ya o kita ha khato kon ebeni ye hatni da ye gon dal kha aro und nal khato khage ha da bani nada ya khada don nishikita jo kon dal kha ado achot zago ta be enap benigi hat ada do ego ta bedesh sho be enap benigi to jo do kaige ita holon do le ita ba alia do le a koko benina a chon on yat ado do o shashino o ya a darneta yis ye gonal kha yin yeta iltra ado yin ya Nzagota iltchato yen dashnish aro eben na ebespeta hazon edi ze shant ehgi quage deile aro ha ein dolnish ha ya ich ahna bato le ha ya edeshnido jo hot an zagon dar khaho nda ad nda ya bellan ille aro nda kote no kaden ado sani has tuits cage ke chini yaje jo bespadat ado jo dik at ani de kosten tanas at da hat no but deji halni nzago ni hit holon holji ado tahtil ton de shaho an orni akoti hot the quishin hotat adin dashni shaho an orni tsada naha shaho an eben koje yan dash khagi benanish ada holon da holon shaho an da orni shahat no koje aida yahast edit akotik at the Cosenzanas a dahi hotza ado del sado danil ni shahot dornisho the qui the shin hotza the quishin art esselin a kohok at a nahaha hot bich ze dole no the such bethada se queen hagate it's ihni dohot egate jo dohot sto shaho and dolnish anacha akodik at the cosensanas a dapet needy do honana za shaho and dolnish selin ebenina ze egito shahot edo quage not ots hat no bahanet ya the lasha ita hatne jo abe hashit shaho and the hobenina shahot ze ekipa ananal akodin de khage a delnish delnish di koto ha ya bech ahnado bahot zago hat no jo aida yasht etat olzen ako benina kon na hashahot zegi ita ananal ako yegonal kha aro yego bahaske ol ako do o shashinda benina kodo ba yeltkego is kodo be hatsasigi altwinch haudni don leilo altwinch betket don leili hot nalni na hot londa in nada dashni hot hat no na be yelkit do be not nitkin a koko eben nache naso kot ni masana ni hitche adon khalchne at ebetlani khatoli benia at ho ebetkhayata hot etopenia kwage hat bachwilne ado koto hot bansin case on leto hot atcha kwage hot na atset on le kushin at baelt hito koto inadol ni khatnigi di no koto hon sogo baelt hito le a coco a hon sodole kodo bankel kushnagi ado a. So this completes my presentation in Navajo on vaccines from the traditional viewpoints.